My wife had a lesion on her neck. She was 71 years old at the time, and she asked the dermatologist that he said, "Oh, you've had that for 5 years." He shaved it and he froze it, and instead of being a pinkish thing on the bottom, it was absolutely black. So it was a melanoma hiding in that lesion. And they dissected her neck and moved the carotid artery over, and there were no black cells anywhere. And so we thought we were out of the woods. Played golf 4 years later. She was perfectly healthy. She played golf that day, and we had spaghetti, and all of a sudden she couldn't swallow. And I said, "We're done with golf, and tomorrow morning we're getting a chest x-ray." Chest x-ray was loaded with tumor, and this is now 4 years after we were told, "Just don't worry, it's melanoma and it's dangerous, but it's not deep enough," etc. In the living room, she stood up and told me, "If you can save one human being of dying of melanoma, please do it for me."
Melanoma is the single most dangerous skin cancer. That's not the most common skin cancer, but melanoma is the most dangerous skin cancer. There are about 70,000 cases a year and about 8,000 deaths. And the incidence of melanoma continues to increase as time goes by. Fortunately, the death rate has been relatively stable over the last decade or so.
So I was diagnosed when I was 11 with melanoma, and that was a foreign word to me at first. But then right after I was diagnosed, I had my surgery a couple weeks after that. And I went right into surgery, and they took the tumor out. And then I got a skin graft, and it spread to my lymph nodes, so I had to get those taken out. And then I got a PICC line and did interferon, which is a type of chemotherapy, for about a year, and got injections and shots and that. All the staff and my family, my friends were such a support system to me throughout it all. You know, being so young, there was always those friendly faces, all the nurses, everybody made the process a lot easier. And through like all the pain, there were still happy faces that made it better, I feel like. And Dr. White was with me throughout it all, and he has been such an impact in my life.
So having cancer is obviously a difficult situation for everybody, but there is always good in what seems to be bad. I've learned so much going through this about it, how people show up when you least expect it. I know that research makes a difference. I mean, I am a walking testament to the benefits of doing research in this area. Because it wasn't long ago that I wouldn't have made it 9 years. I wouldn't have made it 9 months, for sure.
Our research program has really grown by leaps and bounds under the direction of Dr. Levine. Dr. Levine is a remarkable asset. He is one of the foremost pioneers in melanoma care, frankly, not just in the United States, but around the world.
I have 8 children, and 6 of them play golf. So we got together and decided maybe we should have a golf tournament. By the way, the first in the country for melanoma awareness and skin cancer.
The Save Your Skin Melanoma Awareness Golf Classic has raised nearly $400,000 over the last 9 years.
I'd like to thank all the sponsors and all the people who give their time and effort to that golf tournament, because we can make a difference in a cancer disease that has a very high mortality rate. The Save Your Skin Golf Tournament, I am a living example of where those dollars can go and benefit people.
I think it's definitely important to raise money, and so people like me, people who have been through what I have been through, can have a second chance and live life.